Hello, welcome everyone. My name is Sophia Chan-Combrink and I'm the Executive Director of the Canadian Chamber of Commerce. We're a nonprofit, non-governmental organization created in 1977. Today, we have over 1,200 members representing nearly 300 companies, making us one of the largest Canadian business organizations outside of Canada and one of the most active international chambers in Hong Kong. For non-Canadians listening in, it's important for you to know that we are an inclusive and diverse community. And in fact, about 40% of our membership are non-Canadian, so everyone's welcome. What do we do exactly? We deliver 4 services to our members. Number 1 is representation and advocacy of engagement. We also do business promotion, networking, of course, and brand exposure. And like today, we do learning and training and providing insight and providing some information. So today, we are going to bring you a conversation with Maria Sit of Sun Life Hong Kong and Dr. Sarah Borwein, General Practitioner. In fact, they both sit on our executive committee. So we welcome both for their participation and contribution to the chamber. During the session, if you'd like to submit some questions or comments via the chat box, please feel free to do so. And as a general disclaimer, I just like to say the views and opinions expressed are those of the speakers and do not necessarily reflect the policy or position of the CanCham here in Hong Kong. That's all for me. Without further ado, let me hand it over to Maria, our moderator for today's session. Maria?
Okay. Hi, everyone. Good morning and happy Friday. Welcome to the webinar. Look, without a doubt, COVID vaccination is a very hot topic around the world and things are fast moving. There's something new to know and learn every day. Now, here in Hong Kong, 2 vaccines are currently available and the vaccination program has started about 3 weeks ago. Earlier this week, right, just earlier this week, the government has extended the list of people who are eligible to book for the vaccination. Now, the latest figures tell us that over 250,000 people have been vaccinated. That works out to be 3.3% of the population. Now, locally, we know, from the news that 7 people with chronic conditions unfortunately passed away after the vaccination. Naturally, these cases have raised confidence concerns about the vaccines, particularly for people with chronic health conditions. But do we really know if or how these incidents are directly linked to the vaccine? So with so much information coming out every day, it is helpful to take stock and get a grounded and practical understanding of the topic. So I really would like to take the opportunity of this webinar for us to get the facts straight, to equip ourselves with a better understanding, take out some of the noise, debunk misconceptions, and put things in perspective. That's why I'm really delighted to have the conversation with Dr. Sarah Borwein today. Dr. Sarah Borwein, just a little bit of introduction, is a Canadian-trained general practitioner who has been practicing family medicine in Hong Kong for over 15 years. She also studied infectious disease epidemiology at the London School of Hygiene and Tropical Medicine and has been involved in public health communication since the SARS outbreak of 2003. She sits on the Hong Kong Center for Health Protection Scientific Committee on vector-borne diseases and is a member of the WHO International Travel and Health Guideline Development Group. So, Dr. Sarah Borwein, over to you. I think there's a lot of questions that the audience have in mind. I think, with the vaccination program now being rolled out across Hong Kong, what are some of the fundamentals about the vaccines and the vaccination that we should be aware of for ourselves and for our loved ones? And so let's just start with the vaccines itself, right? What are the fundamental differences in terms of the strategies, the ingredients, where they're made, etc.?
Good morning, everyone. It's my pleasure to be here today. This is a very important topic, and I hope everybody's booked their vaccine already. In terms of the kinds of vaccines that we have in Hong Kong at the moment, there are 2 vaccines approved, as I think everyone knows. And when we talk about vaccines, particularly in the context of COVID-19, we talk about traditional and novel technology vaccines. So the traditional vaccines are ones that you're familiar with from flu and hepatitis, et cetera. And the example of that we have is the Sinovac vaccine, which is a vaccine that's made from an inactivated whole virus. It's a tried and true technology being used for many years in many vaccines. It can be effective, but often they have to have something added to them to make them more robust in terms of the immune response. Something called an adjuvant has to be added, and they quite often need multiple boosters. So, but they're cheap and they're effective, and we've been using that kind of vaccine for many years. Although I would say that for respiratory viruses, in general, that kind of vaccine hasn't been tremendously effective. And then we've got novel technologies, of which the two examples are really the mRNA vaccines, like the one we have in Hong Kong, the BioNTech vaccine, and also the Moderna vaccine, which we don't have here, but it's just a very similar vaccine. And then there's also the virus vectored vaccines, which is contrary to what I often get here in the community. AstraZeneca is also a novel technology vaccine. One previous vaccine has been used with that technology in the Ebola outbreak in West Africa, but other than that, it hasn't previously been used. And they're both very promising and very effective technologies. So the mRNA vaccines, I'll talk a little more about that because that's the one we have at the moment. Because I hear a lot of kind of myths and worries that are unnecessary about that vaccine. Because actually it's a really brilliantly simple concept that has been in the works for over 10 years, but this is the first time it's actually made it to market. And the way it works is it gives you a little piece of the code for the protein of the spike protein of the coronavirus. So our bodies work on proteins, and the way that works is our DNA in our nucleus makes messenger RNA that then codes for proteins that run our body. And so in this case, we are not giving you the DNA, we're giving you the messenger, the little piece of code that makes the coronavirus spike protein. And that is inserted into your cells, and it makes the spike protein. You generate a big immune response. And actually the messenger RNA is quite unstable, so it disintegrates within a day or two and is gone. So it's very simple, very clean platform. And I think the concern before it came to market was not that it wouldn't be safe, but that maybe it wouldn't work, that it wouldn't generate a big enough immune response. So one of the great sort of miracles of coronavirus is that the mRNA vaccines have shown to be incredibly effective, stunningly effective actually, and also very safe so far in studies. So one of the things that goes around is that they can alter your DNA, and that is absolutely impossible the way the technology works. There's no DNA in them. Messenger RNA can't travel into your nucleus, so it can't affect your DNA, and it's gone very shortly after delivering the message. It's like installing virus protection software on your computer.
So let's talk about the effectiveness, right, of the different vaccines. I guess just generally, how should we understand this? We talk about efficacy. So what does that really mean? And I guess the second part of this question is with all the variants, the UK variant, the South African, Brazilian variants, are the vaccines that we are getting effective in protecting us against the variants?
Okay, so first question's about efficacy, and the best data we have is on the BioNTech vaccine. In clinical trials that led to its approval, it was about 95% effective against symptomatic COVID, which is very, very good, of course. But we have further data on that because it's now being rolled out in many countries, and well over 100 million doses have been given. And the best data is from Israel, which actually made a deal with Pfizer to get all of the vaccine it needed for its whole population in exchange for giving them very good data on the real life effectiveness of the vaccine. So we talk about efficacy is what you get in clinical trials, and then effectiveness is how does a vaccine actually work in the real world when we actually deploy it. Because clinical trials, as important as they are, they're controlled, and real world is not controlled, right? So, but the data out of Israel are equally stunning, and it's shown great efficacy, probably up to a 97% effective against symptomatic COVID. And they've shown data that it's also quite effective against asymptomatic COVID. Their data suggested over 90% effective, which would mean that it also blocks transmission. It probably isn't quite as good as 90%, but it is clearly effective to a large degree against even asymptomatic COVID. So that's really good and will be important going forward. So you want to ask something?
Yeah, you mentioned something quite interesting. I know we're going to talk about the variants as well, but when you said it's really effective in protecting from asymptomatic COVID, what does that really mean? Does that mean you cannot transmit it? So if you have the vaccine, not only are you yourself protected, but if I'm sitting next to someone who hasn't been vaccinated, are they safe being next to me?
So the data's not quite, the data's not quite ready for prime time yet, but the preliminary indications are that at least to some degree, the BioNTech vaccine is going to cause people to be less able to transmit the virus. It's not going to be perfect. It's not even perfect against getting sick, right? I mean, there's still some failure as with every vaccine, but it looks like it's got effectiveness against that, which kind of makes sense when a vaccine is so highly effective that it will also greatly reduce viral loads, and it will also, to some extent, prevent transmission. The one proviso would be that because this is a respiratory virus, you really want to have immunity in your mouth and nose, which none of the vaccines we have on the market are really designed to do. So it's still being developed, but the preliminary indications are better than we'd hoped for the mRNA vaccines. The Sinovac vaccine, the data isn't as clear. And there are being studies done in multiple countries, but we don't have really good coordinated data that show us exactly how effective it is. Somewhere between 50 and 70% effective, and it seems to vary by population, and it's hard to say because we don't know for sure. But I think it does prevent severe disease and death, which in many countries is the most important consideration. And certainly in the countries in which it was studied, like Brazil.
So I guess going back then to the protection against the variants, what's the data they are telling us?
Yeah. For the BioNTech vaccine, again, we have more data on this, but because in Israel, where it was studied, 80% of the virus at the time was the UK variant. So clearly protects against the UK variant. And it's thought to also provide pretty good protection against the Brazilian variant, but less so against the South African one. The extent to which the real life effectiveness is reduced is not known, but it probably is somewhat less effective, as are all of the other vaccines as well. So right now it's looking like the currently used vaccines do protect against the variants, possibly with less effectiveness against the South African variant. So one thing to remember is that some of these vaccines, at least, certainly the virus vectored vaccines like AstraZeneca and the mRNA vaccines can be changed very easily and very quickly if we need to give another round. It's quite easy to produce another version.
Okay, so I guess there's definitely ongoing research to see how they need to put in the vaccines.
Yeah. We know they're safe and we know they're effective, but when you roll out a vaccine in real life, you get a lot more information, a lot more granular information about exactly how they work, how long they work for, how well they work, etc.
I must say, it is amazing how, COVID-19 vaccines were developed in record time, versus other vaccines, which usually take years, if not decades. So it's really encouraging to hear the news about its effectiveness and how fast evolving the science is behind this.
I think many people have expressed concern about how quickly the vaccines were developed. And I think, while I understand that it seems very quick, at the same time, nothing was skipped. And there's an argument even that they were too slow. I mean, the story is that China released the genetic code of the virus on January 11th. And by January 13th, Moderna had shipped a prototype vaccine to the National Institutes of Health for study. So that's how quick it is to make the vaccine once you know the genetic code. So the vaccines had been in development for a long time, based on the technology anyway, had been in development for a long time. And what happened was that it was just prioritized, and all of the bureaucratic and financial barriers that usually slow vaccine development down, of course, were overcome. Plus, a lot of financial risks were taken. So first, the study phases were all done, but they were overlapped. And the companies took big risks scaling up for production before they even had the phase 3 data results to know that it really worked. So that when the vaccine showed to be effective, they could immediately start producing it in large quantities. And so that's how we've gotten there so quickly, but it's not because we've skipped any important stages. They've all been done. In fact, it's always the case that after a vaccine comes to market, you go on to discover more about it in what's called phase 4 or post-marketing studies. And that's where we are right now. It's just we've never watched so closely before. Everybody's like, looking very closely to see what happens. And we've never done that before, but it is always the process.
So I guess let's move on to talk about the vaccination itself, right? I think, there are a lot of people who are, I guess, sitting on the fence and they're thinking about whether they should get the vaccine, and if so, which one, right? So let's maybe talk about some of the side effects that we've been hearing. And I guess it's a bit of a spectrum, right? You hear some, minor side effects to people having, adverse reactions that, maybe more serious. There's definitely a lot of, of this in the news. So particularly for people with certain chronic conditions, right? It's concerning, it stokes fear and anxiety. But as you said before, I mean, there's a lot of data out there, in other countries who have been rolling this out. Can you tell us a bit more about really what the side effects are and what are some of the, I guess, potential, more adverse reactions for people with chronic health conditions? Sure.
And let me just start by saying that I think one of the things that's happened here is that like I said, we're watching this very closely, but we're actually watching the way the press is reporting on it. We're watching it so closely. It's like holding the camera so close to the image that the image is distorted. So because reporting real time on every death after a vaccine distorts the image. And the reason why is this: if we do have to watch and see if there's any adverse effects after a vaccine in phase 4 trials. It's highly unlikely that a vaccine is going to kill anyone. But think of it this way: if you were to take a half cc of water and inject it into the arms of 10 million people, over the next 2 months, 14,000 of them would die. Some of them immediately after you gave them an injection of water into their arm. 4,000 would have heart attacks, 4,000 more would have strokes, and 9,000 would get cancer. Some of them are going to look like they get it immediately after you injected the water into their arm, but obviously we know that's not what caused it. And it's the same thing with the vaccine. So when you start to see deaths after a vaccine, what you have to do is see, is the background rate, is it any greater than the background rate? Is there actually a relationship, or is this just the fact that people with severe chronic conditions are prone to having heart attacks and passing away, and is probably not related to the vaccine? So that's the first thing I want to say, is take it with, you take it under advisement, the data needs to be looked at, but not every case being reported, like I said, that just distorts the image. So the government, because all the 7 deaths that have been reported have been after the Sinovac vaccine, perhaps because it was rolled out first, and perhaps because it was given in long-term care facilities, et cetera, where people are older and frailer and more prone to just having severe health problems and maybe passing away. So the government came out a few days ago with some guidelines suggesting that people who had unstable chronic conditions, bad diabetes, uncontrolled, etc., uncontrolled hypertension, should not get the vaccine. I want to stress that because there's been some confusion even in the medical community about that. That guidance only applied to Sinovac. It did not apply to the BioNTech vaccine. So the BioNTech vaccine, we know from data elsewhere, because that one we've got very good data from elsewhere, that it's very safe, even in the frail elderly. My 94 and 97-year-old parents just got their second dose, for example, and with absolutely no adverse effects. The main adverse effect with that vaccine is the risk of allergic reaction, which again is very, very small, probably in the order of 2 to 5 in a million, which is a little bit higher than other vaccines, about 1.5 in a million for flu vaccine. And it seems to be very specific. It's related to the lipid coating on the vaccine, on the mRNA, which has something called polyethylene glycol in it, which is polyethylene glycol is, some of you may know Macrogol, which is a commonly used laxative. And if you're allergic to that, you're probably going to have an allergic reaction to the vaccine. So people who have had severe allergic reactions to vaccines or to that substance are advised to get a different vaccine. Other forms of severe allergy or milder allergies are not a contraindication, but just a caution. They'll watch you for a little bit longer after the vaccine. That's really the main one with the Pfizer vaccine.
Right. So it sounds like if you're known to have certain, reactions to, as you said, laxative or egg, I don't know, or certain things, then you should talk to your doctor first to check on your doctor.
Egg allergy is not a contraindication, for example. Environmental allergies are not. Penicillin allergy is not. But you should talk to your doctor about your own case, because they may have specific advice for you.
Okay, so I suppose this advice is very applicable for people, with diabetes or heart diseases as well, because then it's certainly with the guidelines coming out from the government, it's just a high-level guideline, but to really evaluate your risk and to actually then know which vaccine should you be able to get vaccinated. I guess the prevailing wisdom here is to really go and set an appointment and speak to your doctor about it.
Speak to your doctor. The existing evidence is that the BioNTech vaccine is both more effective and safer in the frail elderly. So Sinovac in mainland China, they actually won't give it to people over 60 because of concerns about it not being very effective in that age group. So it's probably a very good vaccine for young, healthy people. Who will probably have a good response to any vaccine, actually, but they will have a good response to that vaccine. For people who are more frail or older than the BioNTech vaccine, there is evidence that it may be safer and more effective. Certainly more effective. Safer, I think they're both safe, honestly.
Okay. Well, while we're talking about the specific vaccines, right? What's the difference between BioNTech Pfizer and BioNTech Fosun? Because you hear all these names,
Yes, and there's yes. So Fosun is the distributing company. It's a Shanghai-based pharmaceutical company, and they have the distributing rights, so they get to put their name on the vaccine. So here it's called Fosun BioNTech. But the vaccine that we have in Hong Kong is made in European factories. Fosun does not have manufacturing rights for the BioNTech vaccine. I know they've applied for them, they've tried to get them, but so far they haven't. And we have been told that all of the BioNTech vaccine that Hong Kong is getting, and they've procured 7.5 million doses, will be coming from European factories. So it's exactly the same vaccine as your family, friends may be getting overseas, but with a different branding on it.
Okay. No, thank you for clarifying that. So then let's talk about, I guess, the people who cannot or should take the vaccine right now, right? Or they might be like, let's just say, women who are pregnant, or they've just had a baby and they're breastfeeding. What would be your advice there?
Okay, for pregnant women, it's under study at the moment. And at the moment in Hong Kong, where we don't have a high COVID burden and pregnant women are not at very high risk, they can probably wait for the trial results on pregnant women. In places that had a lot of COVID, many pregnant women decided to get the vaccine, particularly pregnant doctors. And so we do have data that it is safe in looking at just the case studies, the case series of women who had the vaccine during pregnancy. There's actually a randomized controlled trial going on at the moment of giving the mRNA vaccines in the last trimester of pregnancy and then following the infants up to 6 months. So I would anticipate that we will have approval for the vaccine probably by the end of this year for pregnant women. Breastfeeding women, well, let me just say that no vaccine has ever proven to be harmful in breastfeeding women. The only vaccine we've had a little bit of a caution about is yellow fever vaccine, which is an old live virus vaccine. But even then, we give it if there's a very high risk of yellow fever. All other vaccines are safe in breastfeeding. So we anticipate that both the Sinovac and the BioNTech will be safe in breastfeeding. Currently, the guidelines in Hong Kong are not to give Sinovac vaccine either in pregnancy or breastfeeding. For the BioNTech vaccine, the guidelines are a little more murky here. Elsewhere, they kind of issue that caution that we don't have specific studies, but that we think it's safe. And there is an interesting study out of Israel, again, which has all the good data on this. It has done big studies on this. That giving the vaccine in breastfeeding women actually is beneficial because it allows the infant to be transferred antibodies against COVID through the breast milk. So it provides protection to the infant. So there's preliminary data that it may be a good thing in breastfeeding women, but it's still early days. And so whether you choose to get that vaccine, if you're breastfeeding, the only choice here would be the BioNTech because they've contraindicated Sinovac for breastfeeding. So it would be down to how you assess risk and how comfortable you are with the idea that we don't totally know.
Okay. Well, what about children? I guess if your baby and your mom just, taken the vaccine, then you might get some antibodies there. But what about just children in general? Because right now, I mean, in Hong Kong, children are not allowed to get the vaccine, at least, not below 16, right?
Yeah, that's true everywhere.
There.
Yeah, that's true everywhere. And look, that's almost always true in vaccines. They are almost always studied first in adults and then not always, but almost always, and then in teenagers, and then in younger children, and then in very young children. And that's what's happening here. The vaccine studies for all of these vaccines were done in adults over 16 or over 18. There are trials going on right now in 12 to 16, 18-year-olds, which are underway at the moment. Again, Israel did a pilot study in 600 children with chronic health conditions like cystic fibrosis and demonstrated that the vaccine was safe and effective in that relatively small group. And I think they're starting to vaccinate in that group, but there is no approval for it yet and the trials are ongoing. I do expect that one will be approved in the over 12s probably by the end of the year. And then the trials in younger children will go into next year, and that will happen later. The good thing is that although we do need to vaccinate children in order to get high enough coverage, children are not prone to severe disease, as I think most of us know. And so the urgency for vaccinating them is less than the urgency for vaccinating people over 60 or people with health problems.
Okay. Now, I guess before I talk about what actually happens after you get vaccinated, just on the point of, I guess, for many of us, right, who are gonna get vaccinated if they have not already been, just what should I expect? Is there anything I should prepare before I go in and get myself vaccinated? And also, I guess I heard, right? I think you mentioned to me before that 20% of the population have needlephobia, right?
Yeah.
So I'm talking about not like adverse reactions, right? But are there certain things you should be prepared when you go get vaccinated, and B, if you do have a needlephobia, what can be done about it?
Yes, exactly. And in fact, I know for a fact that some of the reported adverse reactions where people were taken to hospital after the vaccine were actually panic attacks where someone fainted from the panic. And of course, when everything is ramped up in the media that it's somehow dangerous and you're sitting there in the observation area thinking, oh my goodness, is this vaccine going to kill me or something? Then you can understand why someone combine that with needlephobia, and you can understand why someone might have a serious panic attack. If you are, and it is quite common, needlephobia, up to 20% of the population has some degree, and some of them it's really severe. It's to the point where they really have great difficulty getting any kind of medical intervention. Interestingly, and then I saw someone yesterday, interestingly, it often is only medical. So sometimes people can get tattoos, they can, but they can't do a blood test, for example. So it's quite interesting. But if you really have that problem, I think you should talk to your doctor about it, because sometimes we do give people some anxiety reducing drugs, like to take before the vaccination. It won't harm your response to the vaccine. It will just make the experience less unpleasant for you. So I think that is something you could talk to your physician about.
Okay, great. And so now with many of us then, we'll soon be getting the vaccination, the first dose anyway. What do we need to be aware of, right, between the two doses, right? Does that mean you are, do you just start going out with a mask? What are some of the things we still need to be very, conscious of, even like after the first and then after the second dose?
So after the first dose, you really do need the second dose to be properly protected against the virus. There are some data that you have some protection starting 10 days after the first dose, but it's not full protection. So you're still at risk, particularly in the first week or two where you may have been exposed before you even got the vaccine. So you need to take all the same precautions. And at the moment, even after the second dose, there is, this is a rapidly evolving field. Many countries have started to relax some social distancing measures for people who are fully vaccinated, meaning 2 weeks after the second dose. That's how long it takes your body to really mount the proper immune response that makes you protected. And the longer you go afterwards, probably, within reason, the better the response is. So, for example, I'm thinking about my own situation. If I could go home, my parents now being fully vaccinated, if I'm also fully vaccinated, then I have a good sense of comfort that I'm not going to infect them because they're protected and I'm protected. So things like that, definitely. But on a sort of macro level in the community, we're not at the point yet where we can start relaxing social distancing measures in general. But there is talk about it, about that maybe vaccinated people will have somewhat less requirements for social distancing. I don't know what, it was in the paper, so probably many of you listening have the same knowledge that I do, and I'm not sure exactly what they're thinking of when they say that, but it does make us all hopeful.
And that's an interesting one, right? And we just saw it again, just was it yesterday or the day before about this, and it's about how do we I guess nudge people, right, or motivate or incentivize people to get vaccinated, and what's the social benefit that they can get from doing that.
Exactly. And I think that's one of the things that we're seeing, not just in Hong Kong, but in all kind of Asian countries where COVID has been well controlled. People feel less urgency to get the vaccine. It's kind of a bit of a paradox that the countries like the UK and the US, which have had terrible problems with COVID and very high death rates. Well, of course, there it's much easier to convince people to get vaccinated because they have seen the toll up close and they're often personally afraid. Whereas here, people don't really feel at risk from COVID and their incentive to get the vaccine is therefore less. But we do want to get our lives back, right? And the only way for that to happen is to get high levels of vaccination. So you get vaccinated not just to protect yourself, but also to contribute to the community protection, which is a really important reason, and something that we need to do if we're going to ever get out of this loop of suppress and live that we're in at the moment.
Yes, yes. And I mean, this is a really important point, right? You mentioned, certain vaccines actually will reduce the disease transmission because you can get vaccinated. When you get vaccinated, you can still pick up COVID. But depending on, I guess, which vaccines you've taken, then you mentioned that you don't necessarily, you're not in a situation where you will transmit your virus to another person. So I guess is that the right way of looking at this? That it's not just, as you said, not just about protecting yourself, but making sure that you don't become an unwilling carrier of.
Well, and it's even more than that, because we don't really have the data on transmission prevention, and not all vaccines are going to be equal in that regard. But on reducing the disease burden in the community and creating a kind of shield of herd immunity, if you like, so that there is just less. And that is important, obviously, for us in Hong Kong. We can see why from economic, social viewpoint, travel viewpoint, but also because of the new variants, which you mentioned earlier. So the reason these new variants are coming up, let me be clear, the coronavirus is a virus that doesn't actually mutate that quickly, not compared to flu virus, it's much slower. Flu viruses have no proofreading mechanism. When they mutate every year, we get many different strains, and it's kind of a nightmare to make a vaccine to chase it. The reason we're getting the coronavirus slowly mutating, but we're giving it way too many chances. When so many cases, there's going to be mutations, and we put it under pressure with treatments, and to some extent even with vaccines. We're in this kind of race against the variants, which are going to try and evade us. So we need to get people vaccinated as quickly as possible in order to bring down the total level of numbers so that there's less chance for mutation and the development of variants. So it's like the writer Thomas Puyo, who some of you may have seen. He's written some very good lay explanations of the virus. He compares it to the tortoise and the hare, where we're in this race where the virus is the hare, the rabbit, and the vaccine is the tortoise, slowly pushing along. And we know ultimately the tortoise will win, but it's going to be a nail-biting race where sometimes the hare pulls ahead and sometimes the tortoise pulls ahead, and it's not going to be a quick win by the tortoise, put it that way.
So I guess, this is just the first wave of vaccination, if you like, right? And I guess would be a year from now, then we will have to look at getting another vaccination, and just like the flu that you do every year.
It's possible. I don't know yet. Nobody knows that. It is possible, maybe partly due to new variants. We don't know how long the immunity from the vaccines lasts. So we don't know if for that reason you'll need a booster. We don't know if because of new variants we'll need to get a slightly tweaked version of the vaccine. So that's all not known. It may be that for a few years we need to get a yearly vaccine, and then as the numbers come down, we don't need to. But it's all kind of just speculation at the moment. That's going to require ongoing, study and vigilance of what's happening. But if we do, we do. If we need to get another booster dose, then we will.
Great. Well, look, I'm seeing a lot of questions coming through for Q&A, but before we move to the Q&A part of the webinar, we have a special guest with us, Consul General Jeff Neckenville of the Canadian Consulate, who will share a bit about the consular services for those affected by recent quarantine measures here in Hong Kong. I know many of you have heard or may have been part of the recent situation with the gym cluster. Jeff, can you elaborate further what the Canadian Consulate can do for Canadians here in Hong Kong?
Thanks very much, Maria, and thank you, Sarah. This has been and Kancham, it's been a wonderfully informative session. I'm looking forward to the discussion. Bonjour tout le monde. Good morning, everybody. Josan, daga ho. At the consulate, particularly with the latest situation, we've been following it very closely the neighborhoods where many of our Canadian citizens live, including consulate staff, have been directly affected. The neighborhoods have been directly affected by this latest cluster in the last 10 days or so. What we've done is we have lobbied the Hong Kong government quite vigorously, along with other consulates and with representatives of the business community. We've lobbied particularly on the issue relating to separation of children from parents, either in quarantine or for close contacts, or when people need to go into hospital for treatment. So we've lobbied, including in writing a couple of times with the Hong Kong government, and working with, and on one occasion writing jointly with another consulate general, expressing our concern about the way some cases had been handled, and to seek clarification of the government's approach on how children and parents would be managed in a situation where members of a household get ordered into quarantine or into hospital for treatment. I think these efforts have borne some fruit. The government has clarified the kind of principles of its policy, and has publicly provided assurances that they'll make their best efforts when people are going into quarantine to see that parents and children are not separated, and in cases of medical treatment, they would do everything possible consistent with the clinical situation to keep parents and children together, and that would be consistent with World Health Organization guidelines for management of families in situations of quarantine and treatment with infectious disease, as something that we've studied and that we've shared with the Hong Kong authorities. In terms of what we can do in consular support, I think it's important to be clear. We do not have the power, and no consulate has the power to intervene to protect anyone from a public health order, including a quarantine order or an order for treatment. And our advice is to comply with orders that come from the public health authorities. That said, we can advocate on your behalf if you find yourself under a quarantine order. If you're a Canadian citizen and you find yourself under a quarantine order, we would encourage you to contact us to let us know your situation, and we can advocate on your behalf for your well-being. And we have done, over the last year. We have our consular team. We have 16 people, working full-time on consular matters here in Hong Kong, including passport renewals and citizenship documents. Our team has been in contact with the authorities on cases over the last year where we were informed by our Canadian citizens, our consular clients, that their basic needs were not being met. So we encourage you to contact us if you find yourself in this situation, or if you have other concerns. You can do so. You can call us at the consulate at 3719-4700, 3719-4700, and we can share this through the chamber, or email at sos@international.gc.ca. And we have a 24-hour system, so if it's after hours, your phone call will go to a 24-hour center in Ottawa, and they will contact us directly and wake somebody up if necessary to respond to the issue. We also really encourage you to register just for general purposes, to register with our Registration of Canadians Abroad facility at the travel.gc.ca website. And for example, one of the things we do, if you're registered and you indicate that Hong Kong is the place where you live or a place that you visit often, we send out messages from time to time when important developments have occurred in the territory that you indicate. And so, for example, some of you on the call may have received the message on Monday that we sent out to all of our registered Canadians here in Hong Kong with the information in a more concise form, basically what I'm saying right now. We have sent out that information. And anytime there's a change to our travel advice for Hong Kong, we also push that information out through the registration of Canadians abroad. So I really encourage folks to register, but also you don't need to register to get in touch with us. If you have any concerns or questions, please don't hesitate to contact us. Thanks. And I welcome any questions.
Well, thank you very much, Jeff, for taking the time to be with us for this conversation. If the audience have any more questions for Jeff regarding consular services, you can direct it to the Q&A box. Otherwise, we will move now on to the Q&A part of the webinar. Now, I'm seeing quite a number of questions coming in, which is fantastic. But also I'd like to apologize in advance if we can't get to all the questions. But following this event, the Secretariat will send out a follow-up summary of the points discussed and answered today as well. Now, so here are a couple of questions. We talk about, those specific segments of the population who might have to, pay extra attention to, the implications of the vaccination. So one of the, groups of people that we didn't talk about are, kids or people with, well, maybe not kids, but people with autism, right? What do we, is there anything, Sarah, that we need to be aware of and consider if the person has autism?
So we don't have specific data on people with autism for either of any of the vaccines. We also, that they have been included in the vaccine drives in the US, the UK, Israel, elsewhere, and no safety signals have emerged. So I do feel comfortable that they should be getting the vaccine. I also want to stress that in general, if you have a risk factor for COVID, you need the vaccine more, not less. So, all this kind of things that people should be very careful if they have severe hypertension or diabetes. Well, those are the people who are really prone to die from coronavirus disease. They need the vaccine more, not less. And that would apply to any group with risk factors. So, the vaccines are safe. Coronavirus is not. And coronavirus isn't binary either. It's not that it either kills you or you're okay. We know that 10 to 30% of survivors of even mild COVID have lingering symptoms that can be very troublesome for long periods of time. So it's a disease to be avoided, whether you are neuroatypical or neurotypical, or you have risk factors. I think that you need the vaccine more, not less.
Thank you. Really, that's very, I think, clarifies a lot of things for myself as well. I see a lot of questions around, Sinovac, and, really just getting, down to the detail of the differences between the two vaccines that are available in Hong Kong, right? Sinovac and BioNTech, Pfizer. The hardest thing is that we have to make a decision, right? If you decide to pick up the vaccine, which one, right? What is your advice, right? I guess to an individual, on how to make the best choice of vaccine for themselves.
Well,
knowing the pros and cons.
I guess there's no wrong vaccine to get. So that's the first thing, just sort of relax maybe and go with which one you're more comfortable with, but inform yourself first. So one thing to consider for many of our listeners are probably expatriates who will need to travel. At the moment, travel restrictions have only been released in a handful of countries for vaccinated people, but it will come. And at the moment, most Western countries are only recognizing the BioNTech, the Moderna, AstraZeneca, and Johnson & Johnson. So there's that consideration if you want to travel, whether the country you're traveling to, as Canadians, maybe you want to get a vaccine that's recognized in Canada. On the other side of the coin, China has announced that it is only going to, it's not releasing travel restrictions, but making things easier for people who have Chinese-made vaccines. So there's that consideration. And I think it's more down to those practical things. I do think, and maybe this is a slightly controversial, but given the emerging data, that it's better for Hong Kong if more people get the BioNTech vaccine because of the reduction, the likely reduction in transmission that it causes. So it will be better at producing herd immunity with fewer numbers of people vaccinated.
You know, I guess the key takeaway here for me is that look at the data, right? And we don't only have just look at, you know, data from Hong Kong, but really globally, there's a lot of data available. And I think data is what gives us, I guess, the confidence, right?
Yes.
The trust. I guess one question I got also from the audience, and it's a very practical one. It's before you go and, you know, get your vaccination, right? Do you need to fast or not drink for a period of time? Because I heard the opposite just yesterday from a friend who said, oh, you should make sure you drink and eat something before.
Yes.
So which is it?
Yes, definitely, because I think if you fast, you might just faint. So no need to fast, no need to not drink. Please eat and drink normally. There's nothing you need to do before the vaccine. I can tell you, because I've had my first dose, that the vaccine is painless. I didn't feel it at the time. I missed that I'd been given it. And I had no secondary effects afterwards, barely even a sore arm. I can't say that that'll be true for everyone, but that was my experience. So no, you do not need to do any special preparation, just as you wouldn't for any other vaccine.
And I guess, you know, we all hope that, you know, Hong Kong can, you know, get back to normal, you know, as soon as possible. What's your sense of this, you know, happening? I know you don't have a crystal ball, none of us do, but
wish I did.
What I guess is just, you know, what percentage of Hong Kong population needs to be vaccinated, you think, for things to, you know, to be closer to normal? Because right now we're at 3.3%. So, you know, it's something that I think, you know, I'm backing.
The government is targeting 70%, which I think is about 5 million people. It does depend. So the new variants change things because they're so transmissible. The more transmissible a virus is, the higher percentage you need vaccinated in order to keep the herd immunity intact. So it's a moving target. And the answer is the more the better. We really need almost everybody to get vaccinated because this is a very highly transmissible virus. It's much more transmissible than the flu.
Okay. Wow. Thank you so much, Dr. Sarah Borwein, for sharing with us your knowledge, you know, and the latest, you know, the data on this topic. I hope this has helped everyone here who have, you know, some burning questions about the vaccines and vaccination. And this concludes our webinar today. It was, as I said, informative and interesting conversation. Thank you, Dr. Sarah Borwein, and thank you, Jeff Nankerville. And in particular, a big thank you to you all, the audience of today, for your participation. Now, we have more webinars coming up, specifically 4 more this month, and we look forward to welcoming you again. Click on the link to our events now being shown in the chat box and register. Well, happy Friday, everyone, and I wish everyone a fantastic weekend. Thank you and have a nice day.